little bit about himself.
Thank you, Dr. Roberts. Can everybody hear me okay? I've been told I'm soft-spoken even when talking into a microphone. So if you need me to speak up, just wave your hands at me and I'll talk loud. But I told my wife, Lydia, that I was nervous about coming to speak tonight, mostly because I get nervous every time I speak in public. And she said, well, you'll be talking with your friends from church and they'll be kind to you. So I'm relying on you to not disappoint her so that I can weather the anxiety here. But I'm Andrew Tatum. I'm a chaplain at UNC Medical Center, and I work primarily in inpatient psychiatry and psychiatric emergency services. And that means that I provide chaplaincy support, spiritual care, and emotional support to individuals experiencing severe and chronic mental illnesses. So the people that I work with primarily are coming to the emergency room, or they're coming to an inpatient psychiatric unit to receive support for a mental health crisis. Before that, I worked as a pastor and youth pastor in Baptist, Methodist, Episcopal congregations for about 10 years. And lifelong Baptist ordained here at Trinity. Many of you know, I'm married to Lydia. I have 5 kids. And I have a personal and family history of mental illness. I've been dealing with anxiety and depression since I was probably 10 years old. Previous history of some childhood trauma that probably was the root of that. And I've had multiple other experiences of family members and friends having experienced anxiety, depression, panic attacks, all kinds of things. So I have some familiarity with the reality of the need for mental health care. And so I came to the work that I do through both my personal experience as well as just interest in being supportive to people as they're experiencing mental health crisis. So I'm grateful, first of all, to Trinity for hosting this event, the opportunity for us to have some conversation about these things. I'll probably say this more than once. I think mental health is kind of like a mushroom, but it continues to grow and thrive in darkness. And so if we want to be able to offer support and encouragement to those experiencing mental illness, we need to not keep it in the dark, but have conversations about it. And so I'm really grateful that we have this capacity and this interest in having these conversations. Over the next 4 weeks, starting tonight, we're going to have some conversations together. And I do hope it will be conversation because, being trained in a Baptist seminary, I can talk for an hour, no problem. But I think this will be much better if we have some participation and conversation from you all. And we're going to be talking tonight about an overview of our series, as well as an introduction to kind of mental health, mental illness, and some resources for you as individuals and us as a church for how we can offer support to those experiencing mental illness. Next week, we're going to hear from Amanda Price about anxiety and stress. The following week, we'll hear from Dana Sumner about loss and grief. And then Meredith Furr will then be sharing with us about loneliness and re-socialization. Did I say that properly? Yeah, okay, good. And again, I encourage you to kind of engage in conversation, which I'm actually going to invite you to do now. I'd love to hear from those of you who are here in person. Do we have the ability to have conversation online? Okay, so for those of you who are here in person, what brings you here? Is anyone willing to share? What's your interest in coming to these kind of conversations? I'd love to hear. Say that one more time.
Husband and son have anxiety and depression.
So having family experience with anxiety and depression. Others?
I was just going to say participation in church activities.
Okay, being present for a church activity. I love it. Thank you for coming. Any others? What brings you here? Yes?
I suffer from depression, anxiety, suicide attempts. It's just nice to be.
So your personal experience with these kind of issues, and I appreciate you being vulnerable. It's hard sometimes to share about that, and so thank you for doing that. I think we all come here for different reasons, different perspectives. I hope this will be a safe place over the next 4 weeks for us to be able to both share about what brings us to this space, but also to learn from each other, both from those who are speaking, but also from one another in this room about our experiences of seeking mental health and well-being, but also perhaps experiences of when things have gone sideways and we're not as mentally healthy and well as we would like to have been. I'm curious, are there concerns or questions that you're hoping that we will talk about over the next 4 weeks? And I'm trusting Amanda to take notes.
I'm on it.
So what would we like to talk about? What kind of topics are you hoping we will address? Yes.
I wanted to understand the panic attack anxiety. I have several family members that suffer from that. And I walk that fine line of where do you draw boundaries and how do I help?
So for those who are hearing us from home, Susan?
Yeah.
I remembered. Oh my gosh, that's amazing. So Susan would like us to talk a little bit about panic attacks and anxiety and how do you set boundaries with family members, but also be supportive when they're experiencing those things. Did I get it right?
Okay.
Good.
Yeah.
Anyone else? What are some things you're hoping we will talk about over the next 4 weeks?
Well, I think as we're going through this last 2 years, we've had a lifestyle change, and it's not going to go back to where it was.
Right.
So we kind of need to know how to prepare for it, I think.
So you're hoping that we will talk about ways to kind of live into the new reality of current pandemic and hopefully in the future post-pandemic, and how are we going to cope with the ways that life has changed and will continue to change. That's a good one. I'd love, if anybody has an answer to that, I'd love to hear it. Yeah, the pandemic has really, I think, shown, it's been like a spotlight on some maybe pre-existing concerns that many people have had, and it's kind of brought them to the surface for a lot of folks. And I've seen that both in my own life and the lives of the patients that I work with. And so I'm with you. I'd love to have some conversation about that. Well, again, I just want to express my gratitude again for the many churches. There's a good study out by Lifeway Research that said the majority of churches do not discuss mental health and well-being in a parish setting, and the majority of churches, and at least Baptist churches, have no plans to do so. And that either means that they don't think it's important or that they're not prepared to just wade in and have the conversation. So I'm grateful, one, that we're willing to do this, but also that we have folks in our congregation who are willing to start this conversation and feel willing to share. So thank you to the rest of the folks who are sharing as well. I want to start by offering some distinction for us in terms of the differences between mental health and mental illness. And then throughout some of the things I'm going to be sharing, I'm going to give you some data. I'm sorry about the numbers. I'm kind of a data person. So I'm going to give you some information about the kind of the realities of mental health, mental illness in the United States context, and some throughout the world, and maybe the impact of that on our communities and families. And then after that, I'd like to also share a little bit about some ideas about how we as individuals and then us as a church can begin to think about being supportive to those in our communities and our families who are experiencing mental illness or mental health concerns. And then I hope to continue to have some conversation. I don't know how much time we'll have after all that, but I'll try to. How much time do we have? We have an hour, so we'll be here. Okay, good. I think we'll be all right. So it's going to be up to you guys to have some good conversation. So I'm grateful that you're here. So the first thing I want to kind of address for us is mental health and mental illness are kind of used in popular culture interchangeably. You might think of a mental health crisis as the same thing as a mental illness. So for our purposes tonight, and the kind of way that I frame this is that mental health is much like physical health. It's a state of well-being with regard to our emotions, our connections to social life, our thoughts, our feelings, managing life's highs and lows. So we want to think about our thoughts, our behaviors, and our feelings. If we're experiencing kind of a relative balance and equilibrium, we're in a state of mental health. If we experience a crisis that causes those to fluctuate a little bit, but it doesn't last for long periods of time, that wouldn't necessarily be called a mental illness as such. It's maybe a mental health crisis or a mental health concern or problem. A mental illness, though, is maybe a prolonged diminishment of our mental health that is detrimental to our day-to-day functioning. And so we'll talk a little bit about warning signs later on. And the thing I want us to keep in mind is if you experience something that we describe as a warning sign every now and then, but if it doesn't detrimentally affect your day-to-day life, you may not be in a state of mental health crisis, but you might need some assistance. Does that make sense? The other thing I wanted to offer you is, because I work a lot with people of faith who've experienced what I would call stigma in their faith communities. I want to kind of share with you some of my core assumptions about mental illness, mental health, particularly addressing questions of faith. And so I'm gonna, and I see folks maybe taking some pictures of the slides. I'm happy to just share these with you. And maybe we can post them with like the Zoom when we upload to that. Is that okay? So you can feel free to do that as well. So here's some core assumptions for me. The first is that every human being, regardless of their life experience, regardless of the suffering they've experienced, is created in the image of God and is therefore worthy of dignity, respect, and compassion. Every person. For me, also, a core assumption is that mental illnesses are health conditions that involve changes in our emotions, our thinking, or our behavior, or a combination of these things. Mental illnesses can also be treated. If someone is diagnosed with a mental illness, it doesn't mean their life from this point is effectively over. It just means they'll have to make some adjustments, much like if someone has any other kind of health condition. A popular way to think about this these days is to call mental illnesses diseases of the brain. It sounds a little more severe, but it also reminds us that our brain is part of our body. It's part of the holistic part of who you are. Mental illnesses, in my mind and in my experience, are not primarily spiritual problems. What I mean by that is that if you experience a mental illness and you've prayed and you've fasted and you've sought counsel from clergy and from faithful friends and you don't receive relief, it doesn't mean the problem is with you or with your faith. It means you're experiencing an illness that's a part of your body, right? Our faith can certainly be affected by, and our spirituality can be affected by symptoms of mental illness, but my starting point is that it's an illness, not a problem with the person or with the faith of that person. And the last one is key, is that talking about the realities of mental illness does not increase the likelihood that we're going to experience symptoms of a mental illness. Kind of like people are afraid that if we talk about suicide, more people are going to start thinking about suicide. That's just not the case. There's no research that bears that out. And so I think it's important and useful for us to have these conversations. That's a lot of information. Maybe I'll pause for a second. Does anyone have any questions before I move on to some numbers? Because we're about to get kind of deep into some data. Okay, I'll keep going. So one of the other things I want to share with you tonight is that mental illness is relatively common, and the estimates are that roughly 20% of people in the US will experience some form of mental illness in their lifetime. So that's 1 in 5 will experience a form of mental illness. 1 in 20 individuals will experience a form of mental illness that requires significant treatment or inpatient hospitalization. I don't do math that quick, so I can't tell you that percentage, but 1 in 20. 17% of youth will experience some form of mental illness or mental disorder. This one kind of shocked me when I learned about it initially, but depression is the #1 leading cause of disability worldwide. And what we mean by disability, there's a phrase used by public health folks that is burden of disease. And what we mean by that is the effective loss of 1 year of healthy living. And so if we take into account that as a reality, that means that for most of the world, depression is the leading cause of disability throughout the world. Suicide is the 4th leading cause of death for adults in the US and the 2nd leading cause of death for children in our country. And that's more people than suicide, more people than homicide throughout our country as well. Mental illness doesn't just affect the individual who's experiencing it, though. It affects the individual as well as their families and communities. An individual with long-term chronic mental illness is more likely than anyone else, than other people, to experience diabetes or heart disease. And they're at increased risk of substance misuse and addiction, about 18% comorbidity. Family, 8.4 million people are caring for a person who's experiencing a mental health condition throughout the US. And then caregivers spend on average about 32 hours a week caring in unpaid care for someone who's experiencing the symptoms of a mental illness. If we think about community, 21% of those experiencing mental illness are homeless, or they're at increased risk of homelessness. 37% of people who are incarcerated have a previously diagnosed mental illness. The prison system in the US is the largest provider of mental health care in our country. 70% of youth in juvenile detention centers have a previously diagnosed mental illness as well. And 1 in 8 emergency room visits are due to a mental health concern. And we've already talked about depression being a leading cause of the burden of disease or disability throughout the world. Les? Yeah,
Can I
please,
ask a question?
please.
So with the stat about depression being the number one leading cause of disability, is that clinically diagnosed depression that you're talking about there?
Yes. Yeah, I believe so. If you want more detailed information about these stats, all of this comes from the National Alliance on Mental Illness. There's a great website that they have on mental health by the numbers, and there's links to this at the end.
Okay, great.
But if I remember correctly, that is diagnosed
Okay.
clinical depression. Yeah.
Okay, thank you.
We're almost out of the weeds. Thank you for being patient with me. I'm not going to go through all of these warning signs. You see them up there. But what I would like to say is warning signs of mental illness in your life would include sudden or prolonged changes in your ways of thinking, your feelings, and your behavior, and the impacts of that with your community and your family. And the way to think about this is you have a bad day, you're angry, you snap at your children, or you tailgate somebody on the way home. That's not a sign of mental illness. That's a sign of frustration or having a difficult day. But if over a period of 2 weeks or more, generally speaking, you're noticing signs of changes to your behavior, your thoughts, or your feelings, that might be a sign that you are in need of help. And the big thing that the psychiatrists I work with share a lot about, it's not necessarily the symptoms themselves that are problematic, it's the impact on the person's day-to-day life. And so, you know, for you or for someone you love, if you're noticing that your thoughts, your feelings, or your behaviors have changed and it's impacting your life adversely, that might be a sign that you need some help. And there's a lot of good resources out there for how to seek help. Okay, let's pause. Any questions, further thoughts, or concerns? Okay, I'll trust you that you don't have any questions. So I want to talk a bit about what can you do for yourself as an individual who's struggling through the world like the rest of us here. Some of us may have prior history of mental illness. Some of us may be grappling with a family member, trying to figure out how it is that we can keep moving forward in our day-to-day lives. The first thing I want us to remember is don't be ashamed. Remember, mental illnesses are relatively common. And when we're talking about a disease of the brain, it doesn't mean that there's something wrong with you as a person. It's not a moral failing. You haven't done something to deserve this. It's the same as we would share with anybody who's developed an illness. You are worthy of dignity and respect and kindness. And so don't be ashamed, and do talk to people that you trust. You don't have to struggle alone. Again, I've said mental illness is like mushrooms. It gets worse, or it grows in the dark, right? So if we bring it into the light and have people that we trust we can talk to, that makes it more likely that we can seek help in a timely fashion. I think it's important, if you find yourself in crisis, to find a licensed counselor. There's nothing wrong with seeking help if you find yourself in crisis. And remember, this should have been first, but you're made in God's image, like every other person out there in the world. That's the bedrock of what it means to be a human being. And so if you're struggling with mental illness or a mental health problem, you're struggling with a human concern, not something that's just unique to you because of who you are or something that you've done. And then this is kind of, I say this because of the context I work in, it may not be necessary here, but if you're taking medication for a mental health condition and you feel fine, don't stop taking it until you talk to your doctor, because we wouldn't do that with medications for any other kind of illness necessarily. And it's important, you know, to kind of follow the advice of your clinicians if they're helping you kind of stay on track with your mental health. What can we do for others? Let's think in terms of us as a church, as a community. I have this acronym called CREATE. The C stands for commit to being supportive and non-judgmental. That means both toward yourselves, your families, but also to those you might encounter out in the community. R is remember that people with mental illnesses are human beings like the rest of us, created in the image of God. E is to educate yourself about mental health and mental illness. We're doing that now, which is great. Awareness is to be aware of our resources for referral and community support. I've got a long list at the end of this as a good place to start for all of us. T is to teach and preach about mental illness in your churches. Again, we started doing that already. And E is to engage with mental illness and faith by having conversations with each other. There's no reason for us to stay silent about this because it's common. People experience it every day. And then this is important. These two scriptures come up relatively frequently for me. And I don't know why these two have stuck in my mind more than others. But when I'm encountering folks in the hospital who are really struggling to feel that God is present or to understand how God can be present to them when they're suffering, I often think of Psalm 34:18, which is the Lord is close to the brokenhearted and saves those who are crushed in spirit. If that's not a description of a depressed person, I don't know what is. And I like to tell people that, when we can't feel God's presence because we're so down and because we're so depressed and having such a difficult time, for me, that's an indication that God is closest to us. Because when we feel isolated, when we feel alone, that's when God wants to be with us the most. When God always wants to be with us, but it tells me that God is never absent from our lives. And the other is Psalm 46. God is our refuge and strength, a very present help in times of trouble. Therefore, we will not fear though the earth should change, though the mountains shake in the heart of the sea, though its waters roar and foam, though the mountains tremble with its tumult. If that's not a description of what it's like to experience a mental health crisis, I don't know what is. We feel like the ground beneath our feet is shaking, that the places where we've stood that feel solid are no longer as solid as they once were. That can be said of any illness, but in particular of mental illness, I think it can make us think that the things that we're experiencing are unique to us, that we're the only ones who are struggling. But I believe that God is as close to us in those times as he is when everything is going as we expect it to. Okay, let's take a breath. I'm curious, and this is going to require some participation from here on out. What are some things that you found that works for you in terms of managing and making way for your own mental health and well-being? What has been working for you during the last 2 years? I want to remind you, I'm a chaplain, so most of what I do all day is to sit in silence and wait for other people to talk. So yes.
See what I found works is making sure that you shop and make sure you get it. And that works for you because I think it's really important. You get to have mental issue situations that person can fit what your needs are. And so I feel that has worked for me. So, and I have to say, I'm just really proud of church doing something like this because I've heard it in a lot of churches that I've had.
So I want to repeat for those who are hearing us virtually. No, it's not picking up well. So what I think I heard you say was it's important to shop around and find a therapist that works for you. And sometimes that can take a bit of time. It's not that the first therapist that you go to or first counselor you see is always going to work out. But that's an important first step. Was there anything that you would add to that?
That's exactly right.
Yeah. Thank you. Anyone else? Yeah.
Exercise.
Yep.
I think it really became real to me when one of my teenagers said to me, "Mom, you need to go to the gym." I had a really bad attitude, I think. So I think exercise is key. And I also have a question. Is bipolar considered a mental illness?
So to your first thing, exercise is incredibly important, which is why in the hospital where I work, there's exercise equipment, even on the inpatient units where people are having difficulty regulating their behavior because exercise is very important. The second, your question is bipolar considered a mental illness? And I would say the Diagnostic and Statistical Manual, which is like the Bible for psychiatry, considers bipolar to be a mental illness. So, and it can be treated. There's all kinds of different therapeutic modalities and medications that are available to offer treatment and support to folks with bipolar as well. Any others? What are you finding that has worked for you? Yes.
Mine's been more related to events and I've lost years back. I didn't even know there was this called a wellness retreat. But that has been huge for me. Is to go, Mariana, the last place of the Mountain Animals, wellness, and, there's a lot of people around the world that really just check out for me. And it was so healing to be meditate, be just space of power, quiet. World. I have no idea. That was really awesome. But that was very healing.
So having some awareness of the availability of well-being, retreats for well-being, and actually taking the opportunity to do it's been really important for you. Thank you so much. Any others? What's been working for you? I'll tell you what's been working for me is taking walks. And I know that sounds really simple, but going outdoors and taking walks, hearing bird song. And I know, again, that sounds kind of silly, but I think it's the NHS over in Great Britain. They did a study on the effects of bird song on people experiencing anxiety and depression. And there's a clinical benefit to hearing the sound of birds singing and being around green stuff, that apparently they will prescribe bird song for people experiencing depression. So being outside for me and experiencing creation has been incredibly important. And then taking time to try to be physically active. I don't remember who said that. Taking time to do that, which is, a lot of us work and we may sit in front of desks all day and then we drive home in traffic and white knuckle it all the way home. And, finding time to be physically active and attend to the things that are meaningful to us can be really important as well. Anyone else? What has been working for you?
You have to stay engaged.
What do you mean by that?
Engaged, it can be, okay, you like to read, you like to work in the yard, you like to, and I think you have to continue those things. You can't put them on the back burner and say, oh, do that tomorrow. And so I think you have to maintain relationships, and that's harder to do now, but I think it's still do it. Engage people, care about the things that are important to you.
You said two really important things. One is to stay engaged in things that, it sounds like you're saying things that bring you joy, things that help you to enjoy the time that you have that's downtime. The other part that you said that's really important, though, is to have a community, to have other people in your life. And I think the isolation sometimes is unavoidable depending on what a person's mental health is like and what the circumstances are. But to try to find a community and stay engaged with folks who can hold you accountable to take care of yourself is super important, essential, I think. You had your hand up.
Yeah, for me, reading, just taking that time to, I'm a little bit of an introvert, so for me, having that time to reset myself, whether it's reading scripture for my Bible study or reading just a moment of my novel or play, it's just having that quiet time away from others, even my family, helps me to reset.
So reading, having some time to be alone and to reset before you re-engage with the everyday things of life is super important.
Yes, and my son is the exact opposite. He moves around. So it's quite a challenge.
So your son gets recharged by being around other people.
Yes.
Oh, gosh.
Interaction.
I know a couple of people in my life that are like that. So yeah. And you all can probably name them. I wonder, what resources are you aware of locally here in Raleigh or Wake County for people experiencing mental health crisis or who are just kind of struggling to make it through? What resources are you aware of that I may not know about?
I know we engaged with Journey for Life.
Okay.
For teenagers.
Tell me again the name of it.
Journey for Life.
Journey for Life?
Yes.
Okay. Journey
And
for Life.
it was a set of counselors, and they do social group stuff and to work with just other ages.
So Journey for Life, which has kind of group counseling for
It's group and individual.
a group and individual counseling primarily for teenagers, you said?
Right.
Okay.
Looking at helping them to develop their social skills, how to socialize with each other, for those that are struggling, fitting in. School or high school.
That is a good resource. I think for me, the two that I would name that I often refer people to is the National Alliance of Mental Illness. There are chapters in each county, and they provide support groups for both individuals and families. Right now, they're all on Zoom, which some people experience as less supportive than an in-person meeting, which I can completely understand. There's also another organization called Faith Connections on Mental Illness, which is a nonprofit that started with basically an annual kind of meeting with faith leaders, primarily in Orange County, Chapel Hill, which is where I work, but it's kind of expanded. They have an annual conference, they have support groups, and they exist primarily to offer support to individuals and families experiencing mental health concerns who are also people of faith, which is, I think, really important. What other resources would you name that have been important or helpful to you locally? I would say for me, church has been pretty important. Having a community to go to in the times that we needed to be isolated because of the spread of COVID were really difficult, but also having online faith communities has been incredibly important for me. What other questions or concerns do we have? How are you feeling? How are you feeling?
Intrigued.
Intrigued. Where did that come from? It's hard to tell with the mask. Okay. Intrigued. Can I ask about what?
Well, it's just a lot of good information, and, I'm here primarily in health, or routine. I'm a nurse. I was actually a psychiatric nurse for 10 years. So, and I just want to update my information and that kind of thing, and find out that I've been out about it for a while, and to find out what actually happened now.
I think I'm so grateful that you're here because other than other chaplains, the primary group of people I work with every day are psychiatric nurses and physicians. And so I've always felt that it was a really kind of unique skill set and not one that we often think about with nurses. We think about administering medications and helping people with wound care and stuff like that, but there's a whole different set of skills that are needed to kind of be present with someone who's struggling like that. So thank you for being here. How am I doing? I'm just kidding.
One of the statistics and everything, I like that. He doesn't want to.
Sure. What other questions or concerns do you have? Or how are folks feeling right now? I know it's a lot of information and it's can be quite overwhelming to think about, but I think the main thing I want us to keep in mind is that these are all human realities that people have been experiencing, forever. And now we have names for them. Now we have ways to approach them and to offer supporting care. And now we're sitting in a room full of people who are interested in learning about these things, to offer support to one another, to seek support for themselves. And that's a really hopeful sign. So if the information I've shared makes you feel overwhelmed or discouraged, I want you to kind of look around, and I'm going to encourage you to actually do that. Look around at the group of people that are in this room and realize that whatever brings you here, you're all, again, individuals created in the image of God to bear his image in the world, to other people who are also struggling just like we all do. And I think it's a really hopeful sign that we're here.
Feel like one out of that.
Yes.
So great stuff.
Just so that folks at home can hear it, so you said it makes you feel that we're not alone, that we don't have to be isolated and do this by ourselves.
There are other people sitting.
Yeah, I'm really grateful that I was wondering, am I going to be just talking to a screen? And, which I've done before, but it's not my favorite thing to do.
I think also, Andrew, you have to have a willingness and an eagerness to stay involved
Yes.
and to listen and be still. I learned a long time ago this a lot to sit, being still and listening and being patient. He's going to tell you what to do.
I hear I'm assuming you mean God. So what you said was, just so folks can hear, is it takes a willingness to kind of be patient, be calm, and be still, and to kind of engage in patient conversation with individuals who are struggling, and to know that God will guide you through these efforts to offer support to others. There's something I learned after being a chaplain in a psychiatric unit for the last almost 5 years. is I encounter a lot of folks who have beliefs which are demonstrably false, which we would call delusions. That's the word. A false belief which can't be changed despite evidence. It's called a delusion. And nothing that I do with someone who's experiencing a delusion or psychosis, nothing I say is going to convince this person that what they believe, which is distressing to them, is false. Does that make sense? What I can do as a human being, because I'm not there to treat them as a chaplain. I'm not there to fix their belief or to change their minds. I'm there to offer support and encouragement and help them to know that they're a beloved child of God. So that's what I can do to someone who is experiencing a reality that's different than my own. And at some point in your lives, you may experience that with another person that you love, someone you encounter out in the world, someone you encounter here at church, that in the midst of whatever's happening in their lives, they're experiencing something that is not connected to what you understand to be reality. What you can do in that situation is offer love, companionship, support, to be non-judgmental, but also just to remind that person they're a beloved child of God. That can also involve seeking, professional help and encouraging them to do that. And I know that's a struggle many times, but I can't keep saying this enough. The main thing that we can all do is to remind people that they're created in the image of God, beloved by God, and we can offer encouragement and support in that way. Any other questions or thoughts? I feel like we're ending a little early, but yeah.
I was gonna say, Andrew, I think for me, it was really great to hear some of that and for you to share some of this, because I'm going to say, my whole ministry, I have felt overwhelmed by these kind of situations. I'm not really trained. I always say I'm a generalist. I'm like a GP. I know a little bit about a lot of things, but giving myself permission years ago to say that, to say, I need to get you, I'll listen, but there comes a point, I've got to get you to somebody who does this and is good at this, was one of the more freeing things for me, to know that I couldn't fix everybody, and sometimes just one or two sessions with the preacher listening is just not enough.
Right.
And that there is mental illness that needs more emphasis and more deeper kind of counseling. And I say that to encourage all of us that no matter what you feel like you can handle with people, it's okay to say, I need to help you find somebody. Right. And that's been, just for myself, that's helped my own mental health, being able to release that a little bit to the Lord and not feel like you can fix everything.
Well, and I admit I'm coming from the context where everyone I'm working with is already in the hospital. They've been brought there either willingly or against their will. So my perspective is maybe a little skewed from the average person, because that's what I do every day. I'm working with people who can't leave the place where they are because they're there to get support. But when we're out encountering individuals just out in the world, or people in our lives, or coworkers or friends, it can be really distressing and really confusing. And as Dr. Roberts said, overwhelming to kind of know what to do. And I think knowing resources to offer, to refer people to get additional support is really important, which is good because I have a list of them right here. I will say one of the most useful things that any of us could do with some spare time, should you have any, is to take a course called Mental Health First Aid. You can take them online. You can take them, I think they offer them at Wake Med, at Rex, and at UNC. You can take it on UNC's campus. But it's basically a course for lay people, anybody who want to know, like, what do I do if I encounter someone who seems to be in a mental health crisis? How do I refer them? What are the resources? What are some good ways to engage with someone who's struggling? And I don't know how to do that necessarily. So Mental Health First Aid, if you're going to make note of any resource, try to find a course. It's not a short course. I think it's multiple weeks, but you can do them online now. You can do them at your own pace, and I think it's worthwhile to do. These are some resources I encourage you to check out, and I apologize that I didn't provide you handouts today, but we'll make sure they get posted perhaps with the video. And the first one is National Alliance on Mental Illness, Resources for Mental Health, Faith, and Spirituality. These are geared toward folks like us, people who are people of faith, but who also want to know, how can we be helpful? What are some things we should know? Rick and Kay Warren years ago lost a son to suicide. He died by suicide, and the result of that obviously was their grief and their efforts to grapple with that experience for themselves. But also out of that has come a ministry, particularly from Kay, to offer support and information to individuals experiencing mental illness and suicide. And they have some really great resources, both through Kay Warren's website, but also through Saddleback Church. And I find them very helpful. In the UK, they've got the National Spirituality and Mental Health Forum. And then Being Alongside, which is really great, another example of resources for the average individual person on how do you come alongside someone who's experiencing mental health problems and offer them support as a friend. Let's see here. In North Carolina, I won't go through all of these. I'll just make sure that you know that these are resources that are available and they'll be posted with this PowerPoint. The way that I'd like to kind of close tonight is just to remind us that God does not expect us to have all of the answers to these problems. God expects us to learn. God expects us to be willing to engage with people as other people of faith. But I also think God will equip and empower us to know kind of what to do if we're continuing to learn, if we're continuing to ask questions. And I think for me, the parable of the mustard seed is really important. It doesn't mean you have to have all of the faith in the world and all of the skills in the world. The parable of the mustard seed says you just have to have a little bit of faith and God can carry you the rest of the way. And I think when we're starting this journey of having conversations about mental health, that's an important image for me, to think that, yes, this is overwhelming. It's a lot of information, and we don't have to have all the answers at this moment, but we can start the journey together. And I think I'm certainly grateful for the fellowship tonight, and I'm aware that you took time out of your day, out of your evening to come here, and I'm really grateful for that. But I'd like to maybe close us with a word of prayer so that God will continue to guide us throughout these discussions. Is that okay with everybody? Loving God, we are so grateful for your presence with us tonight. I'm grateful for each person who has joined us both in person and online. And God, we ask that you would give us courage and give us wisdom. Help us to know how to proceed as we learn about ways to offer support to those experiencing suffering in terms of mental illness. Help us to know ways to encourage our brothers and sisters to seek greater well-being and mental health, and help our church to become a community that is offering resources for support to those who are suffering among us. God, we thank you for the ways that you provide for us each day, and we thank you for bringing us together here. We ask that you bless us and keep us. In Jesus' name we pray. Amen. Bless you guys. I'm so grateful for you.
So next week, we will be looking at stress and anxiety. Dr. Vander Price will lead our discussion on that, and we're looking forward to that. And we'll start at 6:30 again, and you can join us here in the fellowship hall or online as well. So everyone go in peace this evening.